A very good morning to one and all. So today's topic will be regarding indirect retainers. So indirect retainer, it's a component of car's partial denture. So other components are major connector, minor connectors, direct retainers, indirect retainers, rest and rest seats, dental base, and lastly the artificial tooth. So today we are going to discuss about the indirect retainers. So coming to the definition of indirect retainer, it's a component of a removable partial denture that assists the direct retainer in preventing displacement of the distal extension denture base by functioning through the lever action on the opposite side of the fulcrum line, and when the denture base attempts to move away from the tissues in pure rotation around the fulcrum line. So what is a fulcrum line? It's a theoretical line around which a removable dental processes tend to rotate. So it's a line which connects the last abutment tooth on both sides of the arch. So when an occlusal load is applied to a distal extension removable partial denture, the prosthesis tends to rotate around a fulcrum line that passes through the most posterior rest one on each side of the dental arch. So coming to the functions of indirect retainers, so its primary and the main important function is to assist the direct retainers in preventing the displacement of the denture away from the tissues. And it also has got some auxiliary functions like it reduces the anteroposterior tilting and helps in stabilization, and it also acts as an auxiliary or secondary rest to support the major connector. And in some cases, there will be some periodontal problems in the anterior tooth. So in such cases, we can spring the anterior tooth against the lingual movement by supporting the indirect retainers. Next is the different types of indirect retainers. There are 7 types of indirect retainers. The first one, that is auxiliary occlusal rest. Second one, canine extensions from the occlusal rest. Third one, that is a canine rest or cingulum rest or lingual rest. Fourth one, that is continuous bar retainers and linguo-plates. Fifth one, modification areas. Sixth one, RUGAE support, and the last one, that is direct indirect retentions. Then coming to auxiliary occlusal rest, this is the most frequently and most commonly used occlusal rest, which acts as an indirect retainers, and is always located on the occlusal surface far away from the distal extension denture bases. And it also plays perpendicular to the midpoint of the fulcrum line. So fulcrum line is the line which connects the last abutment tooth on both sides of the arch, and the auxiliary rest, it should be perpendicular to that midpoint of the fulcrum line. So the ideal locations will be central incisors, but ideally the central incisors and lateral incisor, these are very weak. So because of that condition, we'll choose the first premolars as effective and we'll give bilateral rest on the first premolar. So the main distal extension cases are Kennedy's class 1 and Kennedy's class 2. So Kennedy's class 1 means it's a bilateral edentulous area posterior to the remaining natural teeth, and Kennedy's class 2 means it's a unilateral edentulous area posterior to the remaining natural teeth. So in Kennedy's class 1 situations, the bilateral rest on mesial fossa of first premolars act as indirect retainers. And in case of Kennedy's class 2 situation, mesial fossa of first premolar on the opposite side acts as indirect retainers. Then the second type of indirect retainers, these are the canine extension from the occlusal rest. So it consists of a finger extensions from premolar rest to the lingual slope of the adjacent canine. So the finger extension, it will extend from the mesial rest of the first premolar to the lingual slope of the adjacent canine. It can be used when the first premolar is used as a primary abutment. The third one, that is the canine rest. So we can also call this type of rest an cingulum rest or lingual rest. So the canine rest we can use as an indirect retainer when the mesial marginal ridge of the first premolar is too close to the fulcrum line. So the mainly the lingual rest is prepared on the maxillary canines, and the shape of the rest will be V shape or half moon shape, and the location will be always above the cingulum of the maxillary canine. Fourth one, that is the continuous bar retainers and LINGUO-PLATES. The terminal occlusal rest, which are present at either end, function as the indirect retainers. So this terminal occlusal rest, it is always present on the mesial fossa of the first premolars. So the major connector itself does not perform this function as they rest on unprepared lingual inclines of the anterior tooth. So the terminal occlusal rest on the mesial fossa of the first premolars acts as an indirect retainers. A continuous bar retainer or superior border of the LINGUO-PLATE should never be placed above the middle third of the tooth to avoid tooth movement. So if you are placing the superior border above the middle of the tooth, so it will causes the labial tipping of the anterior tooth. Then coming to the modification areas. Modification areas means any edentulous spaces which is other than which determines the classification. These are known as modification areas. So in class 2 situation with modification space on the opposite side, the occlusal rest of the direct retainer of the anterior abutment in that side will act as an indirect retainers. So in this picture, so the anterior abutment will be the mandibular second premolar. So the mesial fossa, mesial rest of the mandibular second premolar act as indirect retainers in the case of class 2 modification space on the opposite side. The next one, that is the RUGAE support. RUGAE area is formed, hence it is used for indirect retention, especially for class 1 situation. Class 1 situations means bilateral edentulous area which is present posterior to the remaining natural teeth. So the retention will be retention and support. It will be from both mucosa and tooth supported. So it is used for indirect retention for palatal horseshoe major connector, because in class 1 situation of maxillary class 1 situation, we will choose mainly palatal horseshoe major connector. Then coming to the last one, that is direct indirect retention. In the maxillary arch where only the 6 anterior teeth remains, the complete palatal coverage is usually necessary. So that is mainly a Kennedy's class 1 situation. So this is not only provides some direct retention by close adaptation to the tissues, it also provides some kinds of indirect retention by covering the anterior tissues. So that's all about the indirect retainer.